The title of our webinar today is the importance of worksite community engagement in understanding workplace violence prevention opportunities. We'll be looking at examples from the Hospital Violence Surveillance System study. I want to talk to you a little bit about SAVR, the organization it's a professional organization that provides leadership and fosters excellence in the science of preventing and treating injury and violence. My name is Marizan Ramirez. I'm a faculty at the University of Iowa, and I am co-chair of the Training and Infrastructure Committee of SAVR's organization. I co-chair with Dr. Ginger Yang, who is from Nationwide Children's Hospital. And what does SAVR do? SAVR is an organization that unifies an identity for injury and violence prevention researchers. We are the only national organization across the country that brings together injury and violence researchers. We provide resource and accessing expertise in the development of research. Oops, sorry about that. Sorry, Robert, my slide, I don't know if my screen has moved over to, I'm having difficulty moving on to the next screen. Sorry about that. Okay. And we provide resources in accessing expertise in the development of research, program, and policy activities. We do have a focus also on teaching and mentoring the next generation of injury and violence researchers. We work collaboratively with practitioners and policymakers to bridge research, practice, and policy efforts. And we engage in advocacy to improve resources for injury and violence research as well as related activities. And we advance global injury and violence research. There are numerous benefits in becoming members of SAVR, and they include professional development and networking, which really SAVR has offered a wonderful opportunity for folks throughout the country to get to know each other from different institutions in both nationally and internationally. We offer mentoring for students and early career researchers. Members also have access to course syllabi, advocacy training and resources, as well as webinars, and many of these resources are available online to members. We have a national conference. In fact, our next national conference will take place in spring in New Orleans, and we have online access to injury prevention, a journal. We provide opportunities for leadership through committees and expert groups. And finally, we do provide access to timely injury and violence news and SAVR position statements. We would like to encourage you all to consider being a member of SAVR if you are not already, and please visit our website, www.savrweb.org. And now what I would like to do is introduce our two speakers for today's webinar, again entitled The Importance of Worksite Community Engagement in Understanding Workplace Violence Prevention. And our first speaker is Ashley Shanefish, who is an occupational injury epidemiologist and an assistant professor in the Division of Occupational and Environmental Medicine at Duke University Medical Center. Her current research focuses on occupational safety and health concerns among workers in the healthcare and construction sectors. Lisa Pompey is an occupational injury epidemiologist and an associate professor in the Division of Epidemiology at the University of Texas Health Science Center at Houston. Dr. Pompey's research interests include musculoskeletal and violence-related injuries incurred by healthcare workers. She is the principal investigator for the study that will be described today. So without further ado, I would like to introduce Dr. Shanefish and Dr. Pompey for today's webinar. And I also do want to let the audience know we will be open for questions. These will be moderated by Dr. Ginger Yang and Robert Rainier from our management committee at SABRE.
Great, thank you so much. We appreciate the opportunity to be here. I do want to acknowledge NIOSH, who's the funder of the study we'll be describing today. So we'll begin today giving an overview of community-engaged research, followed by a presentation of the Hospital Violence Surveillance System study, its background, its approach, and results. We've woven examples of community engagement in, but we'll finish up with some broader lessons learned as well as some resources. And we'll end with questions and what we hope will be a time of discussion with you all as well. The Centers for Disease Control and Prevention defines community engagement as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues that affect the well-being of those people. It's also been defined as the intersection of the complementary efforts of members of the community and public health researchers to improve health. Now, this approach builds on the traditional research process, and rather than being subjects of research, community partners participate in aspects of research, from developing the research question and perhaps securing funding, to recruiting participants and collecting data, and to synthesizing and disseminating research results. Their level of involvement varies. It's been described as being on a continuum, and there are many ways in which engagement is expressed in terms of the types of partners involved and their timing of involvement through the course of the study. This approach has appropriately been described as a blend of science and art. There are several factors to consider when using a community-engaged approach, the first being research ethics. Certainly, this research still requires protection of individuals from research risks, but the partnership that now exists between the community and the research team begs additional ethical questions surrounding risks, benefits, values, priorities. Closely connected is the need to consider research design, whether that design is accepted by the community, and also whether engagement can be incorporated in a way that can be measured and evaluated in the design. We need to think about benefits and costs from the perspectives of the academic research team, as well as the individual participants and entire communities. Some of these might be things we can anticipate at the front end and others not. And finally, there are challenges to this approach. In addition to those that are common to partnerships in general, just how to communicate, how to compromise, for an academic researcher, this approach might be very unfamiliar. Opportunities for mentorship and support from colleagues might be sparse, and there's a constant need to balance having community members being involved in the research process, but also having them being able to participate objectively in the research itself. Community-engaged research is often described from a clinical perspective. This focus isn't surprising. The increased interest in this approach has been attributed to the need highlighted by NIH about a decade ago to really strengthen the dissemination and translation of clinical science to practice. And certainly a community-engaged approach has an important role in this regard, but the principles of community engagement, which have been in practice much longer, have broad applicability. And one context in which elements of this approach can be applied is in the workplace. They can really contribute meaningfully to occupational safety and health research, as well as to the translation of that research to effective solutions. And I'll share a few examples. In 2011, the National Institute for Occupational Safety and Health launched their Total Worker Health Initiative. And this effort is focused on improving worker safety and health through both injury prevention and health promotion. And they encourage approaches that really allow for stakeholders at all levels of an organization to be involved in this process. So as an example, one of their centers of excellence made an online healthy workplace participatory program for workplaces to use to develop programs aimed at improving their worker safety and health. So the program aims to engage employees, again, at all levels in the design of integrated interventions, as this employee participation is what they call key to a long-term sustainable program. And I've highlighted and really want to stress this emphasis on engagement at all levels. This aspect wasn't stated explicitly in the definitions that we saw earlier.